I am Dr.Aref Hussain, uh, consultant in internal medicine, practicing since last 30 years at Aurangabad, Maharashtra. Today I will be going to address you, and my key message for today's address is an eye-opener. The world is really rapidly changing, and with this changing world also, the disease patterns are also changing. There is a tremendous change in the disease patterns. You might be knowing that the words like rest, the peace, the goodness, all these words have become the historical words. And in this today's era of modern era, we are hardly finding any peace, any rest, or any sort of goodness in all of us. And to address all these issues, I am here to discuss some of my thoughts with all of you. You might be aware that why this is so. Why I am telling that these words have become historical words. The reason is the expectations, the high level of expectations. Everybody of us we have made the expectations at its summit, at a higher and upper level. And to meet those expectations, we are hardly caring about ourselves. We don't know when the day is coming, when the night is coming, and what time I am doing. Nobody is taking care of all these things. And because of this high level of expectations only, the things have become, the changes have come in your life. As a clinician, I can tell you, since I'm in practice for the last 30 years, I have seen 3 decades of my practice. And in these 3 decades, what we used to see maybe 20 years or 30 years back, the diseases like, most of the diseases were like infectious, like typhoid, malaria, gastroenteritis, jaundice. Now these diseases are no more the popular diseases. What has come into the life, the so-called metabolic or the vascular diseases. And amongst these 2 important diseases, which they are labeled as the silent killers, like hypertension and diabetes. Now it is everybody home's funda of diabetes and hypertension. In our day-to-day practice, not a single home has left with these 2 important diseases like diabetes and hypertension. And why it is so? Why these diseases have become so popular? Again, I must tell you, our lifestyle, the stress which has come to everybody's life is really tremendous, I tell you. You might be knowing that in our day-to-day life, when you wake up early in the morning, somebody comes to you and tells you that, see, our neighbor, just in the morning, he's collapsed. He had a heart attack. And we are shocked to listen this. And even somebody comes and tells you that your friend's father had a stroke. Somebody has lost the vision. All these complications are happening in day-to-day life. And still, we are not worried about that. So today I am here to tell you that find something different, find something big in your life. Nobody is taking care of their health. I always tell to my patients that you celebrate many occasions like birthday, the receptions, the wedding, the anniversary, and so many things you celebrate in your life. But I am telling them, celebrate a health day where you are going to invite the family doctor at your home. And there you are finding that everybody of your family members going to check your blood sugar level, your BP, the sugar levels, and the blood pressure levels, and all the health issues, all the health points. And then you will feel that you will really enjoy the life. Now, just to add to all these things, in my practice, it's a really sad story that many of us are seeing the patients, and when the patient comes to us and they tell us, okay, see, I'm getting a chest discomfort. I'm a little bit weak nowadays. I'm not getting proper sleep. And when we examine these patients and tell them, see, gentlemen, you are suffering from blood pressure. You are suffering from high sugar levels. The immediate reaction or the immediate feedback which we get from them, the word is no. They tell us, no, doctor, how can I get the hypertension? How can I get the diabetes? See, I'm not getting headache, I'm not having giddiness, I can work, I can walk, I can have so many things going very well in my life. How can I get this? But when we declare them, see, you have to accept the fact. See, you are suffering from blood pressure, you are suffering from diabetes. And when we go into the details of the history, then we find that most of the family members, they have these diseases like hypertension and diabetes running in their families. And the acceptance is really becoming very poor. So my concern is just be aware of these diseases. Don't neglect these two important diseases like hypertension and diabetes. They are really called as the silent killers. You do not know what is going wrong with you. And one fine morning you may be stuck up either with a heart attack or with a stroke or vision loss or a kidney failure. Here the concern is, if any of our family members suffers from these dreadful complications, it's a huge loss to the family. Not only in terms of the personal health loss, but also a big economical loss. Somebody is at home not working, suffering from diseases. When it comes to the real world, especially when it comes to the poor people and below average people, those whose capacity or to spend the money is really a matter of concern, and when they suffer from these full-blown complications of diabetes and hypertension, it's a huge cost burden to their family. And as a clinician, when I'm practicing for so many years, I tell you, in my day-to-day practice, I'm very sorry to tell, many of the patients, they just linger, they just suffer from the complications related to the disease. So, it's my customary duty, it's my request to all of you, be careful about your health. Give some time to your health. I knew that many of us have time to build a good home, good house. We are all the time worried about our children's career. We care about the others. But when it comes to the real concern of us, especially the health, we are really deprived of that. Very sorry to tell that health is not being taken care of. So please be healthy. When you are healthy, your mind will be healthy. Your thoughts will be healthy. And when your thoughts are healthy and mind is healthy, definitely you will do all good things in your life. And these good things will be going to change the total scenario of not of yourself but your family, to our community, and ultimately to our nation. This is really a need of an hour. Again, the other aspect of the diseases which we see routinely, many patients who are coming to me, being a cardiologist and a diabetologist, many patients comes to me and says that, Dr. Saab, I am getting chest discomfort here. And probably it is mostly my acidity problem, which I am having for a couple of weeks, a couple of days. And when I tell them, just get yourself checked, their answer is, please write down some medications for acidity. I will take those medications and I'll be all right. It's just maybe because of my faulty dietary habits I'm getting this sort of thing. But he is not ready to examine himself. And in my experience, I've observed that when anybody tells me as acidity, In my opinion, it's not an acidity, it's the concern about the cardiac problem, maybe the heart attack. When the ECGs are being taken, they are being checked, their blood pressure is checked, blood sugar levels are checked, and we find that they are suffering from the heart problem. They are suffering from diabetes and related complications of diabetes and hypertension. And when we declare them, they don't ask, they tell us, no, it's not like that. So my message for all of you is that we have time for everything, but please give the time for your health. It's really a concern. And God has given, see, I am closing my the presentation with the two important words. Almighty God has given the two important gifts to the human nature. They are in the term of pain and fever. If these two things would not have been there, humanity might not have consulted the doctors, and the lives have gone in that way only. So give the respect to your life, give the respect to their healthy atmosphere, and give respect to the family members, and be aware of these diseases. Make the awareness about these diseases, especially diabetes and hypertension, much more popular, so we will be deprived, or you will not suffer from the complications related to the diabetes and hypertension. Thank you so much for listening to me.